Welcome to the Concerned Parents of Young Athletes podcast, where we dismantle the confusion and provide the facts on structural management, a system designed to prevent injuries, understand the unique structures of every young athlete, and provide effective treatment, all based on structure, science, and common sense. Episode 4, the Dr. Maggs Leg Length Test. Hi, I'm Dr. Tim Maggs. Let's get started. I told you that every young athlete has asymmetrical characteristics in their biomechanics. They're an architectural structure that is imbalanced, right versus left and front versus back. I've told you that there are 5 unique biomechanical imbalances, and every one of our youth athletes is one of these imbalanced structures. So now what we've had to do is 30 years ago, we developed the structural fingerprint exam. About 5 years ago, we developed the Dr. Maggs leg length test. And the reason for that is Dr. Maggs leg length test is a much, much shorter test. The goal is to fix the feet and level the hips, and that can be done very quickly. So how is that done? First of all, we start with orthotics. So everyone should start with orthotics because we're going to talk about the feet and we're going to talk about the epidemic of imbalances and collapses of the feet, and that's the foundation of the body. That's where it all starts. We're going to talk about the fact that over-the-counter orthotics are preferred over custom orthotics, and therefore the cost should be reduced heavily. There are lower quality over-the-counter and higher quality over-the-counter, so we're going to recommend higher quality over-the-counter, but that's where we start. And then once we have those in the shoes, then we will take this x-ray and we will measure the hip heights. And if the hip heights are greater than 3 millimeters, the difference between the two hips, then we want to put a lift, an appropriate lift, under the low hip side. And if we do that, we're going to then fix the feet and level the hips. Once you balance the foundation of the body, the entire foundation of the body, you have now reduced the chances of injury 50%, at the very least 50%. And that's a test that takes 10 minutes to do, but changes the outcome enormously. So that's the Dr. Maggs leg length test, and we are recommending at the very least for that test to be done on every athlete out there. And we need to be efficient doing these testing because there's a lot of young athletes. So thank you for joining me. Be well. If you know any families that have youth athletes in the household, please tell them about our podcast. And until next time, take care.